EDO.
All right, welcome back, beautiful people. This is Forever Young. I'm Dr. John Layke.
And I'm Dr. Payman Danielpour.
And I wanted to thank all the viewers and listeners for sending in your questions, responses, feedback, because ultimately this is how we come up with some of our content. So keep that coming. And today's episode is no different.
Actually, it's very different. Because we're going to switch it up a little bit today. And I think what we're going to do is kind of look at some before and afters and talk about really what makes a great facelift.
Amazing.
And here's the deal. There's so much buzz in social media and around the country and around the world about these words of deep plane facelift, mid-face facelift. Do you have to do a SMAS application? And there's a lot of things that do you have to be a plastic surgeon that's board certified? Do you have to be an ENT or dermatologist doing? There's a lot of uncertainty. There's a lot of trigger words that are said. I want to go to the expert. I know you do a lot of facelifts, and we're going to actually go over some before and afters. We're going to talk about what makes a great facelift, and we're going to talk to double board certified master of faces and noses, Dr. John.
Thank you, buddy. Thank you. All right, a little twist here.
Before we even show our first patient, when someone walks into your office asking for a facelift, what are the first 3 things that you're looking at?
So listen, I think we take a step back even further, because there's so many things that we're going to comment on, even when you look at Instagram. So I think in order to find the right surgeon first, listen, it's always great if you've got a friend that gives you a hint and you use that as a starting point because they trust them. So hopefully you can do the same. But you want to make sure that your surgeon is effectively trained. That means, does it have to be the top university? No, but you want them to be a board certified surgeon, whether it's a facial plastics, whether it's a plastic and reconstructive surgeon. You want to make sure that they're board certified because you know that they've hit a level to know not only what to do, but what to do when there's a problem. The second thing that you want, and I always recommend meeting with multiple surgeons because you're going to be friends with your surgeon for a long time, is you want to make sure that you can have discourse with them, that you can talk to them. Some surgeons, they're very technically gifted, and they also feel that they are, God's gift. And if you can't have a conversation with your surgeon and go over your likes, wants, and things to that effect, you're going to have a rough time if there's any hint of a complication or something that needs to be addressed, right? So make life easy. And then the last thing is you want to go through, and it's not necessarily Instagram or TikTok or things like that, but you want to make sure that the aesthetic eye of the surgeon kind of matches yours. Now, notice some surgeons will put the same type of facelift up over and over and over. And if that's the case, just beware if you don't look like that person, meaning a good surgeon will take into account ethnicity, age, and they'll kind of create separate nuances for each individual patient. This is where some surgeons get it wrong, right? Because they can create the most amazing result in one individual. So let's say we look at, in the news, everybody knows about Chris Jenner, absolutely phenomenal result and things like that. And then we talk about the Jim Carreys and the Bradley Coopers and things like that, where it may not have gone their way, right? It doesn't mean that the surgeon wasn't technically accurate, but what it does mean is that the physician's eye, what they consider aesthetic, youthful, and everything else, might be different than what you're looking for.
Completely get it. I mean, I see it regularly when people come in and they say, I went to get a breast aug and I came out much bigger than I thought because the surgeon thought it would look nice on them. So completely understood. Now, here's the question though is, I'm sitting across from you. Don't pick me apart. That'll be too bad. But let's say the patient comes and sits across from you. What are the first 3 things you look at when you're analyzing their face? And do you look at neck first or do you analyze face first? Because, a lot of people come in and they say, just a little bit here or just a little bit here. And it's really not that easy. It's not easy to just do a little here or a little here.
Right. So you have to understand where I'm going to be coming from. Val Lambros, an amazing plastic surgeon, did some facial aging research using photographs and 3D vector imaging. Pessa, Shaw, these are all individuals that have done long-term studies on actually how we age. The face does not completely descend. It's not like everything just falls. But it also isn't that it just deflates either. So I look at three things. We look at tissue quality. So you look at skin. How did they beat it up? What did they do in the past? Do they smoke? Do they drink? Did they work outside? So you look at skin quality. The second, you look at facial volume. And then you look at facial shape, because each person is going to be slightly different. Where, look, I know that the trigger word is deep plane facelifts, but a good facial surgeon needs to be able to do a smash lift, a max lift, a deep plane lift, because you may have to use slight subtle differences for each individual, depending on the problem. And when you look at what happens as we age, this has been quantified and backed up by data. We lose structural bone. So we lose the eye socket gets bigger in certain areas, the inner upper part and the outer lower part. So the eye takes on an oblong shape. That's why we start looking sad. You lose it in the pure form. This is right by the nose. So when everybody looks at the hole in the nose on a skull, that actually gets bigger. And the mandible, the jaw, actually recesses along with the maxilla, which is the upper jaw. So when you start losing bone, filling is not always the correct option, right? In fact, we do want to look at structure first. Then we look at volume. Then we look at changing skin quality, okay? So those are really the three things.
And do you look at someone's face first or their neck first?
Well, it's interesting because everyone, the human thumbprint of the face are the eyes, right? It's the window of the soul. These are very common adages, but it really is true. So you could technically alter someone's face all the way around it and people will still recognize that person. So that's why periorbital surgery or rejuvenation and eyelid surgery is so critical when it comes to...
You brought up Bradley Cooper.
Right.
He just looks like a different person.
Right. And I'll get into that. Yes, I'll get into that. But so when you ask, do I look at the neck first? No, I look eyes first. Then we start scanning down the face. So it's usually eyes first, then neck or lower jawline, and then some of the ancillary areas. But you have to imagine, we age the same. We're tethered in the center, and we age, it rotates around it. That's why we get the brow, tear trough, laugh lines, and marionette lines, and the jowls form because there's ligaments holding these things in place, and the face is folding over it, for a better phrase, for lack of a better phrase. So, essentially that's the way you look at it, and the repair is going to be exactly the opposite, right? We will re-rotate the face into its more youthful position.
So let's get right into this. Okay. I'm going to put up a picture of someone I find to be very attractive. Okay. And here she is. Okay. And you know her. I know her. She is a beautiful, beautiful woman. So this is her before. I don't want you to tell me what you did, but I want you to walk me through this patient like we're in a consultation together and tell me what you see. Now, what's aging her the most? What is the most concerning? Are there jowls, their neck, loss of jawline? You take me through this. Is it the skin quality? Is it mid-face descent? What is it? And then let's talk about what we'll do after, but let's talk about this.
Right. So when you know the physiology of aging, or we'll say the pathophysiology of aging, you can pick out certain things. So to me, what stands out, you're looking right at her eyes. And we see a little hollowing that occurs in the upper inner part of the eye. When the eye socket gets bigger, the eyes become a little more recessed. We always say as you get older, the eyes have a beady appearance, right? But it's really because the socket itself is getting bigger. Then when we look at the position of the brow and the upper eyelid, that junction, you notice at the outer part of the eye that it starts to hood. So you get an increase in crow's feet, all kinds of different things that are key, and you get extra skin in the upper eyelid. So the first thing I notice, brows are a little lower and flat. We have a hollowing that occurs in the upper eyelid. She still has good facial volume, and but the mid to lower face becomes very square. And this is very common because as the volume starts to drop ever so slightly, or you get a little bit of ligament laxity plus facial deflation, the lower face starts to look a little square. And then lastly, I look at the neck and we see that we've got some visible bands that are showing.
Okay. And you said something like there's lack of volume a little bit, right? Can't you just do this non-invasively, give her to our nurse or do it yourself and just put a little bit of, let's give her 4 syringes of filler and call it a day? Will that improve it or does it make it actually worse over time?
Well, listen, temporarily sometimes it can improve or camouflage an area. But over time, it actually is detrimental because the patient becomes dependent on these things. You still have structural descent. And so once the structure falls, just volume alone is not going to fix that. Right.
That's a very important point here because people are trying to put Band-Aids on aging. And sometimes that Band-Aid actually makes it worse. It covers up something that's just continually getting worse. And then you actually have to do more to it. Now, you said this, we looked at her. What did you do for her? Before I show you the before and after, what did you do for her?
So this is a patient that she wanted to look refreshed, gave me a photo of herself from 20 years ago, and we tried to recreate that. She also felt as she was aging.
Isn't that setting yourself up for failure? That's a tough one.
Well, listen, I think if done correctly, you can achieve those results. It's, unless someone comes to me and they say, look, I've had a heavy brow my whole life and I don't want it anymore. That's different. You're changing a genetic issue that someone's been dealing with. But if we're just talking about average aging, I'll kind of touch on some of the keys. She, in addition, thought that her nose was getting wider. She wanted to just touch it up from a profile view. It wasn't her favorite. So we did a 3D simulation and kind of came up with an idea, and she loved it. So I had ended up doing brow lift. We added some facial volume. I did a face and neck lift on her. And then afterwards, we changed the quality of the skin using a fractionated CO2 laser. In addition, I did an open rhinoplasty with what are called alar-based resections. So refined the nose, raised ever so slightly, narrowed the base of the nose. And so what I was trying to do is she went from a very square face to now more heart-shaped, and we wanted the nose to match. And so it was just a hint more refined.
What you did for this young lady was correct me if I'm wrong, a deep plane facelift.
Correct.
A brow lift. Upper and lower. No,
we stayed away from the eyes because I didn't think that she required it.
Okay. Because I'm looking at this before and after, which I'm going to show you. Her eyes look phenomenal.
Yes.
So
sometimes it's just repositioning that can go a long way.
Very important, guys. Take home message. Sometimes taking the brow up by 2 millimeters will just make the eyes look perfect.
Right. And it's important that you said that about the 2 millimeter part, because really, even if you can get it up 3 millimeters, something like that, that's significant when it comes to framing the eyes. And it's probably where it was 20 years ago. So it's not like the face descends that rapidly. In looking at some of the research, again, going back to Pessa and Shaw and Lambros, we look that as you age, there are key points that do not change. That you do not change.
Because they're ligamentous structures that keep them intact, so they can't move. But it's a very interesting take-home message because people will come in, and I know people say this to you, take my brows up to the sky. Like, whoa, calm down. Calm down. It's even with Botox. They're like, give me those. No, guys. What you have to understand is this is the face, especially around the eyes, periorbital rejuvenation is a game of millimeters.
Exactly.
2 to 3
Couldn't have said
millimeters
it
will
better.
give you exactly what you're getting. So then deep plane face and neck, right?
Right.
And I'm going to show you the after. I'm going to have you take a look and you be the judge of what you think and how you think this surgery went.
Yeah, look, I think that this is I think this is a great example of a refresh, right? She still looks exactly like herself, just younger. And face goes from slightly squarer to now a slightly more heart-shaped face. We've rerouted some of the volume. You know, again, the first thing I notice when I look at the eyes, they're less hollow. There's a slight arch to the brow, which opens that up. There's no need to take extra skin from the upper eyelid. And in rotating the face, she still has that ample central and lateral volume here, but at the same time, it's repositioned ever so slightly. So it feels more natural and youthful. Now, when you look at the neck too, you can easily see that it's much tighter, even from the front. This isn't even a profile view yet. And then,
By the way, you took the words out of my mouth. What you see on Instagram or TikTok or before and afters is always a profile view of neck hanging and then snatched jawline. It is much harder to make somebody look good on this frontal view, the anterior posterior view, because it's much harder to see the actual effects of the surgery.
right. I've always heard people say that if you can do a good neck, that you're an amazing surgeon, but I don't necessarily believe that. I think that if you look at someone, again, first thing you see are their eyes, and the periorbital rejuvenation, the periorbital region being rejuvenated is such a powerful tool. So to me, look, obviously you want both, but at the same time, you know, when we look at these faces, some of them, and amazing surgeons, but sometimes the neck is pulled so tight that it doesn't look youthful. It looks like they paid for it.
Did you know these questions I was going to ask you? Because I was just going to ask you this and say, how often do patients come in and say, tighten me as much as you can, or vice versa, saying, I don't want to look like the windblown appearance? Because
Right.
I look at this woman right here, and everything just looks just perfect. It's classy, it's subtle. You don't change the way she looks, but I'm going to show you her lateral too. But there's a major rejuvenation that's gone there where she looks younger and more refreshed.
Right.
How often do they come in and say, stretch me as far as you can, take me back as much as you can?
You know, I think it's more common than I would like. And unfortunately, it's just not a good fit, right? Because you know, over and over, when you over pull a face or make someone look very fake, it time and time again, your name's going out on that. And they're ultimately not going to be happy because it gives a very unnatural appearance. So it doesn't matter to me that someone can pull a neck so tight that there's zero volume that happens from the chin to the you know, where an Adam's apple would be. But if you look at a youthful neck, there are some contours and shadows that make it youthful. You eliminate some of those things. Like sometimes in a very heavy neck, you have to eliminate the anterior digastric muscle and subplatysmal fat and submandibular glands, which I do a fair amount of. But at the end of the day, if you remove all these structures and it looks so incredibly crisp and clear, it's not natural. So for me,
that's what John's talking about right there.
Yeah. So this is an example where, you know, again, she's got great facial balance. We see we see just an increase in that submandibular shadow.
But the interesting part about this is, for the layperson, they may look and say, well, I don't see anything. Well, it doesn't really look like anything. But let me show you something. This is the money shot. Here's this that all of the plastic surgeons love putting up because the dramatic difference. Ready?
Right.
Look at that?
Yeah, so when you look down, it's especially since COVID, when we call it tech neck and Zoom neck and all kinds of things, because you would lower your neck, your head, and you would
I tried walking around like this.
You'd see, yeah,
looking at the birds.
you'd see an accordion, right? And so the goal is really to help eliminate that, because when you're young, that doesn't happen. And so this is where we, create a much better jawline and shadow, and even in motion and movement, it stays that way. So, this is just a clear example.
Perfect example of a patient who, in all reality, wasn't like she didn't need anything. She was beautiful to begin with. And when she came to you, and I know this woman very well, she specifically said, I don't want to look different. Make me just look like I did 10, 15, 20 years ago. Now, a couple of quick questions about that, because again, I think that every patient's different, right? And every outcome is different. Now, a couple questions about her. Why did she have such a great result?
Well, look, I think first and foremost, she's got a great base to begin with. Right?
And just out of curiosity, sorry to interrupt you, how old is she?
She's in her 50s.
Okay.
So mid 50s.
So does that make a big difference, getting a facelift done earlier? Because I will tell you, I've seen you do facelifts on younger and younger and younger.
Right.
And sometimes I'm like, whoa, that girl's 50 years old. Does she really need it? And you'll say, just look, just wait and see.
Right.
Do you think it's because they're younger, they're healing so nicely?
Well, listen, a couple different things. One, you'll never have as much collagen tomorrow as you do today. And
very good. Very good point.
When you do these things, here's the way I look at it. Obviously, I'm not doing these on 30-year-olds. There are specific cases where someone who's in their early 40s or late 30s would undergo something like this because of massive weight loss, or, through GLPs or whatever it may be. Okay. But I think people are finding that the earlier you do things, they notice two major things. One is that I'll say three major things. One is that it's not such a dramatic change that someone says, who was your surgeon? They'll say, wow, you look amazing. What have you been doing? The second thing is that because you have more collagen earlier, this will last longer. So someone who's got poor tissue quality later in life, and every year you lose another percent of collagen after age 18. So now do the math. You're in 70 trying to undergo a facelift. Is it going to last as long as someone who does it at 50? Definitely not. And then the third thing is really, if you're going to remove 10 years off of your appearance, don't you want to do it earlier so you can really enjoy it? My thought is, in the appropriate patient, doing it relatively early means that you get to rewind the clock. You're 50 some years old and people say, oh my gosh, you look 40 years old. That to me is a huge win.
And I know that the next follow-up question that every single person has is this: how long is this going to last? How long is for this lady, we'll talk about her face and neck. How long is she going to look as good as she does? Now, she's not a smoker. She doesn't piss in the sun. She's got good skin quality, and she takes good care of herself. So she's the ideal patient, and she's in her 50s. So is this going to last for the rest of her life?
No, definitely not. Nothing lasts. Nothing is permanent, right?
We say thank God for that, because it keeps the business going, right? I mean,
but it's one of those things where there's a wide range depending on tissue quality. So let's say the younger individual, it lasts 10 to 12 years. Whereas the older, sometimes even longer. So whereas the older individual, sometimes it's 8 to 10 years. And for tissue, with people who have really, horrible tissue quality, smokers, severe sun damage, look, you're lucky if you're going to get 4 or 5 years out of it, because, there's nothing holding the repairs in place anymore when you've destroyed your skin. So the surgeon has to be very realistic. I can't take someone who comes in and looks 15 or 20 years older than they are and make them 15 or 20 years younger than they are. That's impossible. But you can make some dramatic changes, and you have to prepare that those particular individuals, for all of our patients, we have a specific kind of a regimen that will occur in the first couple months, then the first year, then in the first 5 years, and then the first 10 years, on things that can be done, even non-invasives, that can try to prolong the results.
And now, perfect segue. What do you do pre-op? What do you do post-op to make these people have the best results? And what is the upkeep? Let's say you do this, and then every 6 months you have to do something, or do you believe in retinol? Do you think that people should have microneedling or Morpheus? Or do they just do this and say, peace, I'm out, I'll see you in a couple of years?
Yeah, I think this used to be, surgery used to be very standard. The patient would come in, you'd make sure they were medically clear, you would undergo the procedure, following you'd wear compression, and at certain checkpoints you would see your physician. But now we realize that you can help reduce complications by optimizing your patients in the first place, obviously eliminating smoking, certain medications, and optimizing nutrition and things like that. Then what we do is use some of the newer technologies as far as peptides. We want to help enhance the ability to heal. Post-operatively, we'll even send them to hyperbarics, which will help reduce the inflammation and help fat take. So any fat grafting, it definitely helps the percent of fat that remains. But then we follow them with specific both supplements and peptides that will really help them along the way. In addition, everyone who I perform one of these procedures on, I at 2 months later and beyond will do a Morpheus treatment of the neck. The neck skin is thinner, crepey, so I can pull it as tight as I want. But if you don't change the texture of the skin, you're going to get recurrence. There's no doubt. So I try to do it early on where we stimulate some collagen. So, again, it prolongs the result. Then throughout the years, what we'll do is say, all right, regular facials, keeping the skin clean, regular microneedling to stimulate collagen, and a good skincare regimen.
For those who are scared, apprehensive, think that facelift surgery is like the worst pain in their life, let's just kind of take someone through the journey of a facelift. Here are my couple of questions, and then I'll just let you run with it. Number one, where does the surgery happen? Number two, how long is the surgery? And let's say it's a full facial rejuvenation where you're doing brow, eyes, fat transfer, CO2, facelift, neck lift.
Sure. Even nose. Yeah, whatever it may be.
And does everyone have to go to aftercare? Do people go home? How long do they have where they don't exercise? How long does it take before they can leave the house? How long does it take before they can be event ready? All of these things that you give, I know what you say. These are the pro tips. Talk to me about the pro tips about facelift surgery if I was your patient and I wanted to do it, and I am scared of everything.
So I'll preface it by saying that most patients say that it's not necessarily a painful operation. It's more, listen, it's kind of a miserable feeling. Some people, you're going to be swollen. My thought, so surgery takes place here, fully accredited surgery center right here at our office. And you'll be with us for the day. So let's say you have a 7 a.m. arrival for an 8 a.m. start. By the time you're prepped and we kind of get you situated, it's probably closer to 9. And then you're with me through, early afternoon, maybe sometimes even late afternoon, especially if we're going to do rhinoplasty along with it. But you have to remember, this isn't cardiac surgery. This isn't gastrointestinal surgery. We're shifting skin and soft tissue around. So, technically we can keep you in a steady state for 24 hours or more, but you're not saying that we're going to do that. But to be here for anywhere from 6 to 7 hours, that's not, again, there's not major fluid shifts or things that we're really concerned with.
And just because he says 6 to 7 hours, it's not, he just is a little bit more efficient. Some surgeons take 12 hours to do this, right?
Yeah, listen, sometimes it takes me 5. I mean, It just depends on the individual, right? Or what we're doing. And afterwards, look, there's no doubt that you need a responsible individual for the first 48 hours. There has to be. Your vision's a little blurry because we put a special ointment in it. Or if we had eyelid surgery, you never know. You may have some swelling and blurriness. And so the goal for us is, if there's no one responsible at home that's willing to take on that role, then we send you to an aftercare. You're not going home by yourself. But you have to imagine, by 48 hours, you still have your arms, your legs, your core, your faculties about you. So you can talk, you can be on Zooms, you can do certain things. It just might be a little challenging in the beginning, but you can do those things. I always say the same thing. 10 to 14 days, you will not want to go out in public. You're going to come see me on multiple occasions. And then by 10 to 14 days, you wear your hair down, put on a little makeup, and you go out in public, and most people won't even look twice. You're going to look better than you do now, but it won't be the final result. 6 weeks to be event ready. That means you wear your hair up, put makeup on, you look elegant, and you're not afraid to show incisions. Final results can take 5 months, something like that, because there's always this tiny hint of residual swelling, and everyone's different. Sometimes you come back to the office and I'll continuously or repeatedly inject little bits of a dilute steroid to try to force some of the swelling to be resolved. So that's generally the timeline. But is it the most painful thing in the world? No. There's always going to be those patients. We'll say out of 10, 2 won't take any pain medicine. 4 will take pain medicine the first night or 2. 2 will take it for a couple days, and then 2 will take it all the way through and ask for more. It's just everyone's pain threshold is different, but the majority, it's a little bit of pain medicine for the first couple days, and then you're done.
And when it comes to activity, 6 weeks, 8 weeks, 12 weeks, if you want to start exercising again and back to your normal routine of yoga and swimming and the whole 9 yards.
So I say you can start walking that first week. 4 weeks to strenuous exercise, and 6 weeks to swimming, head down, yoga, Pilates, things like that, where your head's down. But that's, again, I want you to be moving. As far as hyperbarics afterwards, look, I would recommend going every day for the first week. But if you can do at least twice a week for 2 to 3 weeks, it would be phenomenal.
That's great, and we know that hyperbaric oxygen therapy actually helps with a lot of other things as well, just longevity, well-being, just oxygenating your entire body and all of your cells. I saw a world famous plastic surgeon do a big kind of rant about facelift surgery, and he's one of the best in the world, and and I loved what he said, and I want to ask you if you think it's the same. And this will be kind of my closing statement here. He got up and he talked about how we are all humans, and we were born with imperfections. Our faces, our hands, our bodies, our necks. Nobody is perfect, with the exception of maybe you, but but nobody's really perfect. They have blemishes in certain areas. People have moles. There are some contour irregularities to start with, and that he makes it a point to explain to every single person that he does the perfect surgery on everybody, but yet not everybody heals exactly the same way, number one, and not everybody looks exactly the same way.
Right.
And that's the one take home I love to give to everybody I do surgery on. Most of the time, people don't want to listen to that part of the conversation. But do you have this conversation with people? Do you think that we try to achieve perfection, but the reality of it is not everyone's going to look exactly the same.
Right. Yeah, listen, I think especially when we talk about tissue quality and things to that effect, I let people know that, look, there's only so much that you can do. You may require further treatments of several different things just to help get you to where you want to be. You cannot expect to beat up your skin and soft tissue for 50 years, 60 years, and then fix everything in a day. It's just not possible. Now, can we make you look refreshed? Can we have dramatic changes that really can look beautiful? Yes, but there are going to be small imperfections, and that's just the way it goes.
Yeah, and just because your friend who had the facelift done by Dr. Layke 2 months ago, and she's perfectly healed and was in an event and has 0 imperfections, doesn't mean that you, who followed her and came to see him, is going to have the exact same result.
Right.
We all try to strive excellence with every time we do an operation, but sometimes each individual heals differently.
Right. I think a lot of times it's not the skill of the surgeon, again, in the appropriately qualified surgeon. It's not the skill. It's, patient specifics that, these are variables that sometimes are outside of your control. Now, the good part is, again, it goes back to what I said initially. You have to be able to have a conversation with your surgeon. And it's not a hostile one. These are ones in the beginning where when you see a consultation, you say, what if I'm not happy? If the surgeon bristles and says, look, I'm the best in the world. If you don't want to come to me, go to someone else. My answer is go to someone else.
Yeah.
Because if, God forbid, something happens, that's how they're going to treat it. And if you've got someone that says, look, I'd be lying if I said I didn't have my own complications, but I will be with you, walk with you till the end until you're happy.
So important. So before we sign off on this episode, we're going to do a quick facelift rapid fire. How does that sound? Here we go. I'm going to give you this or that, and you pick one. Don't get into the long surgical, answer. Here we go. Deep plane or SMAS?
Deep plane.
Facelift at 45 or 65?
45.
Filler before facelift, helpful or harmful?
Harmful.
Fat transfer, yes or no?
Yes.
Neck lift with or without a facelift?
Always.
Buccal fat removal, yes or no?
In select individuals, I'd say no.
Threads?
Never.
Absolutely not. Mini facelift?
Not worth it.
Best age for a facelift?
50.
I like that. How long should a great facelift last? And we already talked about this.
10 years.
Perfect. Biggest facelift myth?
That it's painful.
I like that one. One thing patients should stop doing before a facelift?
Taking any ibuprofen or Advil.
Nice. And one thing that makes you immediately nervous during a facelift consultation?
Unrealistic expectations. When they bring in photos of someone who's clearly younger or has different facial structure and say, this is what I want.
You're awesome. Thank you for doing this. We're going to do another one with rhinoplasty, but today has been amazing.
And breast and body. Don't you worry. You're not getting away from this one. Listen, thank you for that. That was a lot of fun. And again, I want to thank all of our viewers and listeners for sending in feedback. And hopefully you learned a little something today. If you have any questions, go ahead, reach out to us because we'd love to answer. And once again, this is Forever Young. I'm Dr. John Layke.
I'm Dr. Payman Danielpour. You can check us out wherever you check out your podcasts. Check us out on your social media feeds. Instagram, TikTok, YouTube. Peace.